Now, the Aged Care Royal Commission begins public hearings in Adelaide today, in about 20 minutes, in fact, with evidence from a variety of witnesses, including family members of abused residents. Social Affairs correspondent Norman Hermont has more.
There has been a huge concern over the years about the quality of aged care, and as we saw last year, the ABC led some of that crowdsourced journalism that drew huge numbers of responses of people who have had negative experiences with the aged care system. The government called the Royal Commission in September, just before that very groundbreaking Four Corners report that we saw on ABC last year.
Yeah. And so what are the terms of reference, and have they come in for some criticism, or are groups generally happy that they're broad enough?
Well, that's an interesting question, Joe. There are some consumer groups, advocacy groups, who probably would have liked to see more from the terms of reference, but the way they're structured, they are fairly wide-ranging with their language, so it really depends on what we see in the coming weeks of how the Commission will take those terms and interpret them. Now, this is just the beginning of a long process, as you can imagine. The Commission's going to be here for 3 days this week, next week in Adelaide, and then it will continue hearings for every 4 to 6 weeks until December of this year, at least, and the final report is due in April of 2020.
So who will give evidence today?
Well, we're expected to hear today. We have a witness list that includes we have for abuse and neglect. We'll probably hear some very harrowing stories of experiences with the healthcare system, aged care system rather, including families of those who suffered at the Oakden aged care home here in Adelaide, a particularly notorious case. We're also going to hear from some consumer and peak bodies today, Council on the Aging and the Old People's Advocacy Network. So we'll be getting a first-hand view and then an advocacy view today at the hearings.
And Norman, I noticed that over the weekend the government made an announcement about funding for aged care places. I guess we can expect this to be a key issue in the election campaign this year as well.
I would imagine, Joe. I mean, a lot of people who probably are aware of aged care coverage, they may not be aware of the incredible amounts of money involved. It's an $18 billion part of the budget. That money that was announced over the weekend, part of that goes to home care packages. There's a big backlog and people who are waiting for assistance who are staying at home. Some of that money will also go for aged care residents who are in nursing homes. So it is going to be an election issue, but of course it's going to take place with the background of this Royal Commission happening. So it will be interesting to see how those intersect in the coming months.
Yeah. And Norman, what are some key things that aged care groups are looking for to come out of this Royal Commission?
Well, there's really several key points, Joe, but the really big ones are regulation. Why have the regulatory regimes of aged care failed so consistently, really since the last Aged Care Act was brought out almost more than 20 years ago? There really have been numerous inquiries. That has always been identified as a problem. Some changes have been made starting at the start of this year, but really regulation is a huge issue. The other one, of course, is staffing. So much of this, if you talk to advocacy groups, comes down to what are the staffing issues? Why aren't there ratios in terms of staff to residents in nursing homes? So many of the issues come down to that, about the training of staffing. So those are two of the big ones that advocates and consumers are going to be looking for and see what comes out of this Royal Commission.
And aged care providers have been pushing back pretty vigorously against any move towards staff to patient ratios.
Look, I would say now that we have the Royal Commission on the horizon, everything is in play, Joe. But traditionally, over the last 20 years, that is a correct statement. The aged care providers have generally pushed back against that. Now, part of that reason from a policy perspective is the government believes that you need to create a financial sustainability for people who are providing aged care. So that is certainly the provider point of view. A lot of advocacy groups, however, point out that, look, there already is a lot of money in aged care. Something like, as I mentioned, $18 billion. Of that, about $11 billion is for people who are in aged care residences. That's about almost $60,000 per resident. So there's a lot of money in the system, but what you often hear from advocates is there's not a lot of transparency in the system. It's very hard to see where that money goes. That's one of the big issues that people are going to be looking for some answers from this Royal Commission.
Norman Hermont, the Commission has just got underway in Adelaide. Let's take a listen in.
We propose to lead evidence of or about, firstly, the concerns of some advocacy bodies regarding the current state of the aged care system. Secondly, the clinical issues affecting elderly people and general challenges that arise in meeting clinical needs. Next, the concerns and views of some medical and nursing professional bodies relating to the current state of the aged care system. Next, demographic information relevant to the provision of aged care services. Next, the perspectives of government and the principal regulator as to the state of the aged care system. And finally, the perspectives of some workforce representative bodies as to the state of the aged care system. And Commissioners, you will also hear evidence from people about their experiences in the aged care system and their opinions on issues that need to be addressed. There are several key topics which will be considered. There will be evidence describing the system of Commonwealth subsidised aged care in Australia and how it is operated, monitored and regulated. As I mentioned at the outset, there will also be a background paper on these matters available in the near future. Much of what I will now say will be available in that paper in due course. What is aged care? In 2011, the Productivity Commission described aged care as covering, and I quote, the services available to older people who, because of frailty and other age-related conditions, are unable to live independently without assistance, end quote. Those services can include one or more of the following. Firstly, assistance with everyday living activities such as cleaning, laundry, shopping, meals and social participation. Secondly, help with personal care such as help with dressing, eating and toileting. Next, healthcare such as medical, nursing, physiotherapy, dietetics and dentistry. And accommodation. As people age, the amount of support and care they require changes, both in intensity and in type. Often people begin by needing assistance with household tasks, such as cleaning and transport. This is the case regardless of whether or not the person also has a form of disability. These services can supplement support provided by a carer or are a substitute for carer support for a person living alone. Over time, this may increase to more supported services such as service integrated housing, complex community care and residential care. Who accesses aged care? Aged care services directly affect a significant proportion of the Australian population. In order to access subsidised aged care under the Aged Care Act, 4 criteria must be met. First, the recipient must be assessed as eligible. Second, the care must be provided by a government-approved provider. Thirdly, the care must be provided through a government-allocated place or package. And fourthly, the care must be of a specified quality. According to the Department of Health, over 1.3 million Australians access aged care services. Millions more are indirectly affected through informal care and support arrangements, social networks and community groups. Many people know someone, family, friends, colleagues, who receive aged care services. The vast majority of people who access aged care services require home-based care and support. And around 20% live in residential aged care. Those entering permanent residential aged care tend to be frail and have an average age of 82 years for men and 84.5 years for women. One of the drivers of the need for aged care is the increasing number of people with dementia. Current estimates are that there are 376,000 Australians living with dementia, with almost half of these being people over 85 years of age. The Australian Institute of Health and Welfare, from whom you will hear tomorrow, anticipates that there will be around 900,000 Australians living with dementia by 2050. A hearing of this Royal Commission in May will focus on this issue. This Royal Commission will also consider the issue of young people with disabilities living in aged care. We will address the issue of young people with disabilities living in aged care at a hearing later this year, currently planned for September. How do people engage with the aged care system? In 2013, the Australian Government established the My Aged Care portal. My Aged Care is intended to be a single entry point for and a gateway to access to Australian Government subsidised aged care services. The My Aged Care portal is a website and a call centre. It provides information on aged care, refers people for needs-based assessments and attempts to assist in finding appropriate services in their local area. We expect to lead evidence from people of their experiences of using the portal during this hearing. There are strong views amongst some of the witnesses about the current effectiveness of the My Aged Care portal in enabling elderly people to gain access to their services. There have currently been external reviews of aged care, including of the My Aged Care portal. There's a recent review that concluded that the portal was an important step forward for service delivery. However, the review also noted low levels of community awareness about the portal, along with implementation challenges and concerns about accessibility. We will examine the issues around access and engagement with the aged care system in more detail at a later hearing. What kinds of care are available? The kinds of care available depend on the needs of the person seeking care. There is care that is received in the home and residential care. For care received in the home, there are two mainstream programs. Firstly, the Commonwealth Home Support Program, CHSP, and home care packages. The Commonwealth Home Support Program generally provides entry-level support services, whereas a higher level of funding is available through a home care package. Residents of home care packages are currently assessed at one of 4 levels of need. The Australian Government rations or caps the supply of both home care packages and of funded residential care places. There are also forms of flexible care available, including transition care, short-term restorative care, multi-purpose services and innovative care. There are also special flexible programs available for Aboriginal and Torres Strait Islander people. For veterans, there is Veterans Home Care, as well as the Veterans Community Nursing Program. Residential care is designed for people who have been assessed as needing higher levels of care than can be provided in their homes. Residential care can either be long-term or for shorter periods of respite care. How much do people pay? The aged care system relies on funding from the Australian Government as well as contributions from the person receiving care, where they are able to do so. The Australian Government pays for the bulk of aged care in Australia. A person accessing residential care or a home care package is means tested to determine the amount they can afford to contribute for their care and for their accommodation if they require residential aged care. The fees vary depending upon the means of the person and the type of care they are receiving, and can be significant. People are protected by hardship provisions and by annual and lifetime caps on the care fees they can be asked to pay. The care fees paid by people living in residential care can be as much as $27,000 per year. The maximum care fee for home care packages is almost $11,000. Depending on the type of care a person is receiving, there are additional fees beyond this for daily services or accommodation, and there may be fees for extra and additional services. Fees are generally much lower in the CHSP, the Commonwealth Home Support Program, where there is no formal means testing. What does aged care mean to the economy? A number of advisory bodies have been established by the Australian Government to provide government with advice on various aged care related issues, after consultation with the industry, consumers and other sectors. One of these is the Aged Care Financing Authority, which provides advice on funding and financial issues. The authority estimates that annual revenues derived from aged care services providers total around $22 billion. In 2017-18, total Australian government expenditure on aged care was around $18.2 billion, and this is projected to increase by some $4 billion by 2021-22. There are nearly 2,000 aged care providers approved under the Aged Care Act, ranging from complex corporate entities providing a full array of services to small businesses which provide a single service or operate a single facility. In addition, another 1,456 providers deliver services under the CHSP. The sector employs over 366,000 workers with another 68,000 volunteers, and is part of the healthcare and social assistance sector, which has been the largest growing part of the economy since 2015. Another important advice body is the Aged Care Sector Committee. In 2016, that committee produced a document advising on a roadmap towards a consumer-driven, more market-based aged care system. How is the quality and safety of aged care regulated? The terms of reference give specific attention to quality and safety. The evidence in the hearing will shed light on the meaning of quality and safety in the context of aged care from a variety of national perspectives. The starting point must be to understand the framework for safeguarding quality and safety, including the complaints processes that are supposed to be available when something has gone wrong. A system for safeguarding safety and quality needs to be effective through having an avenue for complaints, including a system for following up and improving, as well as effective protections for complainants. The quality and safety of care provided within the aged care system is subject to a complex raft of legislation and subordinate legislation, which is administered by different Australian government agencies. The principal piece of legislation in the framework is the Aged Care Act 1997. Medical care provided within the aged care system is also subject to Commonwealth and state legislative requirements. It is unnecessary to refer in detail to much of the aged care legislation in this opening. However, the objects of the Aged Care Act articulate what individuals and the community can and should expect of aged care laws in Australia under the current Act. The objects are set out in section 2.1, which has now been displayed. The objects include A, to provide for funding of aged care that takes account of 5 factors that are listed in that paragraph. B, to promote a high quality of care and accommodation for the recipients of aged care services that meets the needs of individuals. C, to protect the health and well-being of the of the recipients of aged care services. D, to ensure that aged care services are targeted towards the people with the greatest needs for those services. E, to facilitate access to aged care services by those who...
Okay, looks like we've got a bit of a glitch there with the feed. Care got underway. We heard some of the opening statement of council assisting. Barbara Briggs is giving evidence now. She's been a campaigner for reform in the aged care sector. Her husband was a patient at the Oakden Older Persons Mental Health Service facility. Let's take a listen now to Barbara Briggs.
After 1 week, we noticed a huge decline in his health. After our family expressed concerns at his deterioration, we left but within an hour we were told he had been transferred to the Royal Adelaide Hospital. He'd been over-medicated by given 10 times the dose, 500 milligrams instead of 50 milligrams of his prescribed antipsychotic drug, Seroquel. He was suffering severe bruising on several parts of his body, was dehydrated and suffering from pneumonia. To this day, I don't know what happened to Bob at Oakden. Was my questioning the only reason that his ill treatment eventually came to light? Did anyone at Oakden or at the Royal Adelaide Hospital or anywhere else report anything or raise any concerns with the authorities? I think about those who hurt Bob, and I wonder whether they are now employed somewhere else. I wonder if their employers know about their previous conduct. I keep coming back to the fact that whenever I walked out of the repat, I was happy that Bob was in a facility where staff cared for him as a person, where they tried to understand him and meet his needs, where my visits were welcomed by the staff, and where I knew Bob was as content as he could be given his condition. From the very first day, I never felt that about Oakden. Why was this the case? Why couldn't Oakden have offered the same level of staffing and care as he received at the repat? How come other professions didn't get the same gut feeling that I got each time I went out there? My family and I tried to find out what had happened to Bob. I made a request under the Freedom of Information legislation. This was a confusing and frustrating process. The information that was returned to me was difficult to understand. It gave us no answers. Families should not need to jump through hoops through the Freedom of Information system. I think that once a hospital sees bruises or signs of potential abuse, this should be triggered as a domestic violence type alert. And I add too, I'm sure if I had taken Bob to the Royal Adelaide Hospital, the state he was in, I would have been reported to the police as to why he was in such a bad state. To my knowledge, there's not even a system within the mental health service for reporting this level of incidents. I am worried that this is a system-wide issue. I think there needs to be protection in the system. If there are red flags like bruising, there should be a procedure in place to alert the authorities. If the red flag goes up, then there needs to be an emergency and urgent process that can be triggered. Complaints and inquiry system. I found it so difficult and frustrating and time-consuming to get answers to my questions and to have my concerns taken seriously. I had no experience in working through bureaucratic processes. Also, it's difficult to describe the stress I was under. My very sick husband had been moved into an aged care facility, and suddenly I had to deal with living without him. My lifestyle changed, and I was dealing with things that he had once dealt with. I needed to juggle visits to the facility. I was feeling guilty that I was not able to take care of Bob myself. When we saw signs that Bob had been physically abused and neglected, the stress and trauma only increased. I should not have had to battle so long and hard for months to be heard. Eventually, with the support of the Community Visitor Scheme, the media picked up my story and people started to listen. I could so easily have decided before that it was not worth all the trouble I was coming up against. I was coming up against so many brick walls. There needs to be an easier to use, accessible and quick way for people to get information, particularly when they have serious concerns about what is going on in aged care facilities. There needs to be a very clear pathway that an everyday person can follow if they or someone they are caring for experiences a problem. Preferably, the process should not be online. Not everyone is confident with online systems. This can put up barriers straight away. There has to be a much easier, uncomplicated road to travel, with personal contact to get information and get some answers and get some attention. It should be clearly advertised in a highly visible place, and this may have a deterrent effect as well. There is now an 1800 number that people can call. This should be displayed on nursing home walls where families can see it. The number should be answered by a person 24 hours a day. It should have the capacity to trigger an urgent response. Staffing. Another area that I think needs to be improved is staffing. Caring for the elderly is not a job that everyone can do. It's a special group of people that are good at doing this kind of work. They need to be passionate about their work and have empathy for the elderly. They need to be motivated to care for the aged as if they were caring for their own family. Processes need to be put into place to screen out those unsuitable for the work. Aged care workers need to be registered and highly trained with a clear set of qualifications required for registration. Staff also need to be appropriately paid, acknowledging the complexity of their work that they do. Furthermore, if an aged care worker does something wrong, this should be documented in a national database. Future employers should be able to see that there is a mark against their name in the system. Hopefully, this will stop unsuitable workers with bad traits moving to other facilities, including interstate. There needs to be more accountability when failings occur. CCTV cameras. I believe that CCTV cameras should be installed in all common areas of aged care facilities. There should be an option to have them installed in private areas. This would mean that if anything goes wrong, there is a clear record of what has happened. CCTV is not just for the safety of patients, it also protects staff. End of life care plan. Aged care and hospital staff also need to respect the wishes of family members, especially when it comes to end of life care plans. My family and I had previously made an end-of-life plan for Bob. We knew that he wasn't going to recover and that life for him would get progressively more distressing. We decided that he not be given resuscitation or antibiotics unless he was in pain. I remember we had spent so much time on all of that. There was a lot of paperwork involved, and it was a very difficult decision to make. We made the decision as a family. This plan was ignored by the system, or at least did not follow him from Oakden to the RAH, where he was given antibiotics for pneumonia. Although I questioned this at the hospital, the process went ahead. I was so distressed by Bob's condition and neglect that I felt helpless and numb and frightened, and was in no state to insist that the documented end-of-life care plan be followed. My conclusion, there is so much more that I could refer to, which points to the fact that Bob and other residents at Oakden were not given the care, dignity and respect to which they were entitled. The accommodation at Oakden, for example, was like something from the 19th century. One time when I visited Bob, I was let into his bare, locked room where he was lying on a bed with just a sheet underneath him. There was no seat on the toilet in his bathroom. There were only paper towels in the bathroom. He was there on his own. It was like a prison. While at Oakden, Bob was given medication to sedate him, and other patients at Oakden also appeared sedated. I felt strongly that this was done by staff to ease the management of residents, rather than for a true concern for their needs and welfare. We need to learn and move forward from our mistakes and develop an aged care system that Australia can be proud of. It needs to be one where we know that our loved ones are given the care and the dignity and the respect that they deserve. My family and I welcome the Royal Commission as an opportunity to have our say. My submission will not save Bob from the mistreatment that he experienced, but I hope and pray that this commission will lead to recommendations and actions that will ensure no one else will suffer as my husband suffered, and no more families will have to go through the heartbreak which my family experienced.
Thank you, Mrs. Speaker.